Hi everybody, I'm Dr. Biomed. Welcome to the Biomed Cafe channel. In this channel, complex biological and medical contents are presented in a simple, classified, and summarized form. Also, I have designed a quiz game for you. I will explain about the quiz game in the end of this video. The topic of this video is the action potential. Please subscribe to this channel, and if you like the contents of this video, please like it. Action potential. Each message in the nervous system is sent by an action potential that passes through the neuron's membrane. Definition of action potential: sudden, fast, transitory, and propagating change of the resting membrane potential. Generating location of action potential are in neurons and in muscle cells. You can see the shape of a typical action potential here. Action potential stimuli. Action potential stimuli can be divided into three subgroups: subthreshold, threshold, and suprathreshold. Subthreshold stimuli cannot cause an action potential. Threshold stimuli have enough energy or potential to produce an action potential, and suprathreshold stimuli also produce an action potential, but their strength is higher than the threshold stimuli. An action potential is generated when a stimulus changes the membrane potential to the values of threshold potential around -50 to -55 millivolt. The action potential has all or none law. In this law, subthreshold stimulus will cause nothing, and threshold and suprathreshold stimuli produce a full response of the excitable cell. The length and the amplitude of an action potential always are the same, but the frequency of an action potential increases when the stimulus strength increases. Action potential phases. The first phase is resting potential. Voltage is approximately -70 millivolt. Voltage-gated sodium channels are closed. Voltage-gated potassium channels are closed. And sodium-potassium pump helps to keep the resting potential stable. Outside of the cell is positive, and inside of the cell is negative. The second phase is depolarization. It is after a stimulus such as CAMP or a neurotransmitter. The voltage is approximately -55 millivolt. Some of voltage-gated sodium channels are open. Voltage-gated potassium channels are closed. And sodium-potassium pump does not move ions. The outside of the cell is positive, and the inside of the cell is negative. The third phase is rising phase of action potential. This varies only when the action potential to threshold level reached. The voltage is approximately between plus 30 and plus 40 millivolt. Most of voltage-gated sodium channels are open. Voltage-gated potassium channels are closed, and sodium-potassium pump does not move ions. Outside of the cell is negative, and inside of the cell is positive. The next phase is falling phase of action potential or repolarization. Its purpose is to restore the resting membrane potential. The voltage is approximately between minus 55 and minus 70 millivolt. Voltage-gated sodium channels are inactivated. Most of voltage-gated potassium channels are open, and sodium-potassium pump does not move ions. Outside of the cell is positive, and inside of the cell is negative. The last phase is hyperpolarization or undershoot. The membrane returns to the resting potential. The voltage is approximately between minus 71 and minus 75 millivolts. Voltage-gated sodium channels are closed. Some of voltage-gated potassium channels are open, and sodium-potassium pump does not move ions. Outside of the cell is positive, and the inside of the cell is negative. Refractory period. It's the time after an action potential is generated during which the excitable cell cannot produce another action potential. Refractory period can be divided into two subgroups: absolute refractoriness and relative refractoriness. Absolute refractoriness is the period when the generation of a new action potential is not possible. It overlaps the depolarization and around two-thirds of repolarization phase. It's because of the inactivation gate of a voltage-gated sodium channel. Once the sodium channel is back to its resting conformation, a new action potential could be started during the hyperpolarization phase, but only by a stronger stimulus than the one that initiated the current action potential. Relative refractoriness is the period when the generation of a new action potential is possible, but only upon a supra-threshold stimulus. This period overlaps the final one-third of repolarization. Propagation of an action potential. An action potential is generated in the body of the neuron. It's propagated through its axon. Propagation doesn't decrease. The only possible direction of propagation is forward. The action potential doesn't move, but rather causes a new action potential of the adjacent segment of the neuronal membrane. The speed of propagation depends on two items: the thickness of the axon and myelin. The thickness of the axon. The larger the diameter of axon equals the higher the speed of propagation. And myelin. The higher thickness of the fiber causes the higher propagation speed. In myelinated fibers, only the Ranvier nodes depolarized, and myelin nodes are jumped over. In unmyelinated fibers, every part of the axonal membrane depolarizes. It makes the propagation slower. A skeletal muscle action potential vs action potential in neuron. They are similar together but have some differences. 1. Neuron hyperpolarize, but a skeletal muscle does not. 2. The action potential duration in neuron is about 1 millisecond, but the action potential duration in a skeletal muscle is about 2 to 5 milliseconds. 3. Membrane potential of neuron is minus 70 millivolt, but membrane potential of a skeletal muscle is minus 90 millivolt. Cardiac muscle action potential. Heart cells are involved in cardiac action potential. The action potential duration in cardiac muscle is 200 to 400 milliseconds. There are 5 phases in cardiac muscle action potential. Phase 0 or depolarization. In this phase, sodium channels open. Phase 1 or repolarization. In this phase, sodium channels close, but potassium channels open. Phase 2 or plateau. In this phase, calcium channels open and potassium channels open too. Phase 3 or increased repolarization. In this phase, calcium channels close, but potassium channels open. Phase 4. In this phase, calcium channel close, sodium channels close too, but potassium channel open. Thank you for watching. Now it's time for the quiz game. I have put the link to the quiz game in the description of this video. Download it for free and enjoy it. In the next video, I will talk about another biomedical topic in a simple, classified, and summarized form. Until the next video, bye!